and to facilitate smooth induction of anesthesia and prophylaxis to some other allergic reactions. So these are the standard drugs that we give, like lorazepam, midazolam, and these drugs. And drugs like atropine is not used nowadays that frequently, like when we were students. Nowadays, you can use glycopyrrolate, especially if the patient is undergoing lobectomy or pneumonectomy or that type of airway instrumentation procedures and other drugs. And a word about preoperative fasting policy. The morning list, like anesthesia, may start between 8 to 1 p.m., nothing by mouth from 12 midnight, and other clear fluids. But clear fluids can be taken up to 6 o'clock in the morning. That means 2 hours is required for clear fluids. What do you mean by clear fluids is see-through, non-particulate, non-carbonated, non-milk containing fluids. And afternoon list, like list starting about 1 o'clock or 2 o'clock, patient can have light breakfast in the morning by 7 o'clock, and then clear fluids up to 11 o'clock. And the patient is a child, then obviously 6 hours for solid milk, formula, and other milk products, 4 hours for breast milk, and 2 hours for clear fluids. And it is important that the elderly, those who have undergone bowel preparation, sick patients, children, and breastfeeding mothers should not be left for long periods without hydration. So sometimes they may require intravenous fluids, so start intravenous fluids before they are shifted to the OR. So major cases will be done in the first in the list, not last, unless they are infected or septic. And diabetic and young children should be done morning first in the list. And if there is any change in the schedule, anesthetist should be contacted about the alteration of the list. And the risk of proceeding with surgery should be balanced against those of postponement. So if there is any reason for postponing the surgery, then should weigh the reasons of postponing or doing the surgery.
Sir, we are having just 2 minutes. Sir.
Yeah, and surgery should only be postponed if there is an opportunity to improve the patient's clinical status and therefore reduce the overall risk. Thank you. Thank you for your patient hearing. And I invite you all to BAPU 2013, which we'll be conducting on September 15th and 16th in SWIMS, Tirupati.
Now, hall is open for discussion. Sir, one thing I want to this one. Sir. Can you clarify with regard to the antihypertensive? You have to give this one antihypertensive, but specifically about the AC inhibitors and ARBs, and also about the metformin.
About
metformin for the diabetic, this one, which is most important.
Yeah.
For the
Usually biguanides they need to be converted into the insulins, and because there's a possible complication of lactic acidosis perioperatively. So definitely those drugs, and I did not mention because time is not sufficient. If the patient is on chlorpropamide or biguanides, they have to be converted. And all antihypertensives have to be converted. And sometimes if there is a positive, especially for renal transplant patients, the morning dose of antihypertensives usually be skipped because to have a slightly higher blood pressure intraoperatively so that the kidney perfusion will be better and you have good urine output.
But this one, AC inhibitors especially, they may cause more hypotension, and this one, for that reason they will tell AC inhibitor. Be cautious with regard to the AC inhibitors especially. And with regard to metformin, better metformin should be stopped 48 hours prior to this ones, and renal, this one has to be this one. It is because previously we blamed metformin for the lactic acidosis. But actually it is the perfusion of the kidney which will be affecting this one. So for radiological investigations also, wherever the contrast is used, and for the operation and post-operatively for 48 hours, it's better to stop the metformin, which they have mentioned clear cut with regard to the management of
biguanides need to be stopped and converted to insulins.
Thank you very much. Thank you very much for the extensive.
Thank you.